All right, let's jump right in. Today we're tackling a topic that affects millions of people, the inguinal hernia. Now, you might think it's just a simple bulge in the groin, but the truth is, it's way more complex and honestly, way more interesting than that. We're going to explore all the different types, each with its own unique story. So, let's get into it.
So here's what we're going to cover. First, we'll start with the anatomy, why this one spot is so vulnerable. Then we'll get into the two main players, direct versus indirect hernias. After that, we'll see how surgeons actually classify them, check out a whole gallery of uniquely named hernias, and wrap it all up by talking about why these details matter so much.
First things first, we've got to understand the landscape. Why is this one specific area of the body so prone to problems? Well, it all comes down to a structure called the inguinal canal. Okay, so let's tackle the big question right off the bat. What is it about our groin, about this inguinal region, that makes it a natural weak spot in the wall of our abdomen? This diagram here gives us a perfect overview. You see, the inguinal canal is basically a tunnel running through our abdominal muscles. It's a necessary pathway, for sure, but its very design creates this inherent weak point. Now look closely at that diagram. See the area they've labeled Hesselbach's triangle? Keep an eye on that. It's a critical zone for hernias, and we'll definitely be coming back to it.
And you know, if you remember just one thing from this whole anatomy section, make it this: the inferior epigastric artery, or IEA for short. Where a hernia decides to pop out in relation to this one artery, well, that's the single most important clue that tells us exactly what kind of hernia we're dealing with.
And that one landmark, that artery, is what brings us right to our next big topic. Using that as our guide, we can basically split almost all inguinal hernias into two major camps, direct and indirect. Let's see how they compare.
So here's the absolute key distinction. It's all about location, location, location. If the hernia sac pokes through lateral to, that is, on the outside of, the inferior epigastric artery, it's an indirect hernia. If it comes through medial to, or on the inside of, the artery, it's a direct hernia. One is usually something you're born with, and the other is something that develops over your lifetime.
Now this table, this really lays it all out, doesn't it? You can see just how different these two are. Indirect hernias, you see those in younger folks. They're way more common in men, and they have this distinct pear shape because they're usually congenital. Direct hernias, on the other hand, are acquired. They pop up over time from wear and tear, aging, chronic coughing, things like that. They're more common in older people and have a more rounded shape.
And look, to really hammer this point home, here it is straight from the source. The hernia's position relative to that artery is the defining factor. Medial's direct, lateral's indirect. It doesn't get much clearer than that.
But okay, so we know direct versus indirect. For a surgeon, though, that's just not enough information to plan a proper repair. To get more precise, to really bring some order to the chaos, they use formal classification systems.
Yeah, these systems are not just for some academic exercise. They are honest-to-goodness practical tools. They help describe the size of the hole and the health of the tissue around it, which is information that directly shapes the entire surgical strategy.
Two of the most common systems you'll hear about are the NIHIS and the Gilbert classifications. Now, I know they can look a little intimidating at first glance, but trust me, they both build on that same fundamental direct versus indirect idea we just covered. Let's break down the NIHIS system. It's actually a pretty logical progression. Types I and II, they're both indirect hernias, but the difference is how big the opening is that they're passing through. Then you have type 3, which is a broader category for defects in the back wall of that inguinal canal. This includes direct hernias. And finally, type 4 is for any hernia that's come back after a previous surgery, which, as you can imagine, is its own special kind of challenge. The Gilbert classification takes a similar approach, but zooms in even closer. For indirect hernias, it's pretty straightforward: small, medium, or large. Easy enough. But for direct hernias, it makes a really important distinction. Is the entire floor of the canal weak, or is it just one little localized hole? Getting that level of detail is absolutely critical for planning the right kind of repair.
Okay, now for what I think is the coolest part. We're moving beyond the standard classifications and into the real rogues gallery of hernias. This is a whole collection of hernias with special names, usually named after the surgeons who first described them, or for their really unique and sometimes dangerous characteristics.
First up in our gallery is Richter's hernia, and this one is, well, it's devious. It's particularly nasty because it doesn't trap a whole loop of your intestine, it just nabs a small part of the wall. This means it can actually cut off the blood supply and cause the tissue to die without causing a full blockage, which makes it sneakier and a lot harder to diagnose.
And this image just shows you the problem perfectly. See that? It's not the whole loop of bowel getting stuck, just that little pinch on the side. It's a subtle but incredibly dangerous situation, one you see most often with femoral hernias.
Next, we have the sliding hernia, or as it's also known, hernia en glissade. This one's a whole different level of complex. Why? Because it's not just some intestine poking through a hole. Nope. In this case, an actual organ, like the bladder or a piece of the colon, is making up part of the hernia sac itself. You can imagine that makes the surgical repair way, way more delicate.
You hear sportsman's hernia, and you think, well, it's a hernia, right? But actually, that's a bit of a misnomer. It's not a true hernia because there's no bulge. It's really a soft tissue injury, a tear in the muscles of the lower abdomen, often seen in athletes who do a lot of explosive twisting and turning. It causes chronic groin pain, but when a doctor examines them, there's no typical hernia to be found.
And finally, we have the pantaloon hernia. And honestly, the name tells you everything you need to know. Remember that key landmark, the inferior epigastric artery? Well, a pantaloon hernia is when you have both a direct and an indirect hernia at the same time. One sac is medial to the artery, the other is lateral, and together they straddle that blood vessel just like a pair of pants.
All right, so we've covered a ton of ground, right? From the basic layout of the land to this whole gallery of different hernia types. So let's bring it all home and talk about why getting the diagnosis exactly right is so incredibly important.
The reason surgeons have all these names and these detailed classification systems is because every single variation presents a unique puzzle to solve. A simple, small, indirect hernia, that might call for a pretty straightforward repair. But a sliding hernia or a recurrent one, that requires a totally different, much more complex surgical game plan. So let's just boil it all down. What's the big takeaway here? It all starts with the anatomy, specifically that inferior epigastric artery. That landmark tells us if a hernia is direct or indirect. From there, the classification systems give us even more detail, which then guides the entire surgical approach. And finally, all those named hernias we talked about, they highlight the really unique, tricky situations that surgeons have to be ready for.
So we've got the what down pat. We've seen the many faces of an inguinal hernia, from the common to the complex. But that just opens up a whole other can of worms, doesn't it? The next big question is, how does the surgeon look at one of these specific types and choose the right repair from the dozens of techniques out there? Well, that's a fascinating topic for another time. Thanks for watching.